Hi everyone, you may have seen my video showing dystonia, and that is where the hand clenches or the fingers curl. It can happen to hands and feet, and it can be temporary or it can be fixed. So this is one symptom of functional neurological disorder. Again, this is not medical advice, this is just sharing some experience from different people, including myself, of how to deal with this particular symptom. One thing that really works for dealing with FND is to work out what your triggers are. So that may be something psychological, something physical, just what sets off your symptoms. And that takes a bit of process, and you don't always find out what your triggers are and what brings on symptoms. So it's just trying to be aware of what's going on in your mind and in your body, and working out how to deal with this crazy condition that we have. So dystonia, it could be caused by a trigger, or it could happen when you're in a relaxed state. Sometimes functional symptoms come on when you're just lying still and not doing anything. It seems like when the brain is distracted, you're less likely to have functional symptoms. So what we need to do is retrain the brain for what is normal, like a normal movement or a regular position for the body to be in. So neurosymptoms.org is a really excellent website you should check out. It has information on a lot of these different symptoms. Some of it is for medical professionals for diagnosing and treating, but there was a couple of thoughts there that were useful. So if you've got your clenched hand or your awesome rocks sign, what did someone say? A secret handshake. Think of your dystonia as a secret handshake between us with FND. Changing position could be a way to restart the brain. So changing how you're sitting or lying or standing up if you can. Now, the one that worked best for me was tapping. So if my hand was in a clenched position and I could not relax, and I could not pull my fingers out to fix them into the right position, and it felt like it's clenching so tight, and then it's really painful afterwards because it's straining all of the muscles in my arm or wherever it is, so spasms, dystonia. And even my carer trying to pull out my fingers, it was so tight. So my best technique for dealing with dystonia is tapping. So either you doing it or getting someone who's with you tapping on the hand or tapping on another part of your body. It like somehow released the whatever weird tension was going on, and like even as I'm doing it now, I can remember exactly what it felt like having dystonia in my hand, and it released my fingers from that clenched position, and then I would feel exhausted. So I had to do that for several minutes sometimes, and then it would release and it could relax. So tapping is one technique. Second technique, distraction. So if I was just in a relaxed state, lying there or thinking something, and there was some thought pattern that was making a symptom come on, I distract, and at that stage all I could do was watch TV. So I would try to watch TV and be distracted by what's happening in the story and the characters, and then over time it would just go away. So maybe after 20 minutes or something it would just stop if I'm distracted by something else. It seems like with FND, the more you focus on the symptom, the harder it is for it to go away. So we want to distract ourselves to something else. And you'll hear more about distraction techniques in some of my other videos. So tapping, distraction, and waiting for time to pass. These are good techniques for dealing with dystonia, clenched hand, clenched foot. And there's some other ones that I've heard about, such as you looking in a mirror, because the brain thinks that this position is the regular position and it's not. So looking in a mirror and comparing the right side and the left side, to think that it's normal, and then that will make it revert back to being actually normal. I didn't really understand that one. Usually in my case, I can tell this is not right. It's uncomfortable and it's horrible. But it seems like the brain it can't process that that's not how it's meant to be. It thinks that that's how it should be. So if you give the mirror trick a try, let me know how you go. And if you have any other tips for dealing with functional dystonia, leave a comment and let's help each other out. One last quick tip: keep your fingernails trim, and if you're sore afterwards or you feel like it's going to come on, you can try and put a tennis ball or something in the palm of your hand, or like wrist guards or something, to try to reduce the pain or sharp fingernails getting stuck into the palm of your hands.